Hi, my name is Elizabeth Donaway, and I am a junior in high school at Pinecrest School in Fort Lauderdale, Florida. I conducted my research on developing a novel drug delivery mechanism for pancreatic carcinomas. By the end of 2014, 46,420 people will have been diagnosed with pancreatic cancer. 39,590 of those people diagnosed with the disease will die within the year. Pancreatic cancer's 5.5% 5-year survival rate is dismal at best and stems from the late diagnosis and minimal options for treatment once diagnosed late in its progression and metastasis. The three main treatment plans for those diagnosed with pancreatic cancer are surgery, namely the Whipple procedure, wherein a large portion of the head of the pancreas, a section where most tumors form, is removed, leaving the patient diabetic, chemotherapy, and radiation therapy. Both chemotherapy and radiation therapy target general areas where tumors are most likely to form instead of localizing on individual cancer cell populations. Because these treatments target large areas in order to encompass the full range of the cancer, they often kill healthy cells in addition to the cancerous cells. I became interested in this topic after a family member was diagnosed with pancreatic cancer and given 6 months to live. I was surprised at the lack of treatment options for late-stage pancreatic cancer patients despite all of the technological advancements in medicine. I wanted to develop a different method to treat cancer that was more specific to cancer cells only and would eliminate the deleterious effects other treatments cause to benign neighboring cells. After researching about gold nanoparticles being used to detect various cancers, I wanted to combine cancer treatment and the up-and-coming field of bionanotechnology. In order to find a way to construct a vector that would deliver medicine to only the affected cells, I searched for proteins that bind to biomarkers found on the surface of cancer cells and came across the type 1 interferon proteins, interferon alpha and interferon beta, which are found in humans and expressed in small amounts in response to mutated cancer cells. These interferons upregulate expression of p53, a tumor suppressor that acts to induce cell apoptosis, or in other words, cell program death. The goal of my research was to create a biocompatible construct consisting of the interferon proteins alpha and beta that only interact with cancer cells, as only cancer cells have the interferon alpha receptor that these interferons bind to. This would allow for specific cancer treatment that would cause cell apoptosis only in cancer cells while leaving the healthy pancreatic cancer tissue. The goal of my research was to create a biocompatible construct consisting of the interferon proteins alpha and beta that only interact with cancer cells, as only cancer cells have the interferon alpha receptor that these interferons bind to. This would allow for specific cancer treatment that would cause cell apoptosis only in cancer cells, while leaving the healthy pancreatic tissue untouched. I fabricated gold nanoparticles and added binding molecules to both the particles and the interferon so I could attach them to each other to create a drug delivery mechanism. I then quantified the size of the particles to determine physiological suitability. I finally transfected the pancreatic cancer cell culture to determine cell apoptosis due to the gold nanoparticle interferon conjugates. This new mechanism was successful in inducing cell apoptosis in the pancreatic cancer cell cultures. There is a lot of research to be done with this technology, and it opens up a new field of cancer treatment exploration. New treatments in the future will be able to target cancer cells only while maintaining a patient's quality of life during treatment. By creating new technologies such as this, we will ultimately be able to change pancreatic cancer's bleak prognosis. Thank you for watching my video.